Hi, my name is Chandler Massey, and my disease is Diphtheria in Russia. Diphtheria is a bacteria that secretes a toxin that causes inflammation and a leather-like coating of the throat and airways. Diphtheria toxins can cause damage to other organs such as the heart and nerves. The bacteria cause an adherent membrane to form on either the tonsils, pharynx, or nasal cavity. Coming in direct contact or breathing the secretions of the toxins can be very harmful to the uninfected. Treatment and vaccination. DTP is a combination of vaccines for protection of 3 infectious diseases: diphtheria, pertussis, and tetanus. Daptocel is an active immunization for infants and children from 6 weeks to 6 years old. Adacel is a single-dose immunization booster for ages 11 to 64. Once infected with diphtheria, antibiotics such as benzylpenicillin and clarithromycin can all be used to treat the disease over a 2-week period. Penicillin is a commonly used antibiotic from the late 1920s. It is used to treat many diseases and bacterial infections such as diphtheria and syphilis. Common side effects include headache, diarrhea, and sore mouth. Erythromycin, also known as EES, is very similar to the antibiotic penicillin. It is commonly prescribed to patients allergic to penicillin. It is used to treat many respiratory tract infections and has common side effects such as stomach cramping, nausea, and vomiting. Clarithromycin, also known as Bixin, is a macrolide antibiotic invented by Tassio Pharmaceuticals in 1970. It is used to treat respiratory infections such as diphtheria, tonsillitis, and bronchitis. It prevents bacteria from growing and causing infections. The most common side effects are nausea and stomachache. The Russian Federation. The president is Vladimir Vladimirovich Putin. They are the 6th wealthiest country with a poverty level of 12.7%. Healthcare is funded by mandatory medical insurance. The life expectancy is around 68 years. There are only 43 doctors per 10,000 citizens, which ranks them 12th among industrialized countries. Since the collapse of the Soviet Union, the health of the Russian population has declined as a result of social, economic, and lifestyle changes. Diphtheria in Russia epidemic. The epidemic was the largest outbreak in a developed country since the 1960s. It consisted of more than 80% of the total cases in the entire world. There were 115,000 cases, which resulted in 3,000 deaths. Most cases were adult citizens. In Russia, at the time, there was a large time gap for adults receiving their immunization boosters, which increased the infected. Resurgence of diphtheria. There was a striking resurgence of diphtheria in the 1980s across the European nations. It is believed that the return of diphtheria was caused by low immunization coverage in adults, movement of citizens to high populations, an inadequate supply of vaccines at the time. To control the diphtheria outbreaks, high immunization coverage is very important. Prompt diagnosis and management will also have an effect on the control of diphtheria. The study of diphtheria among children. Children who have received the school booster immunization were proven to be 90% less likely to be infected with diphtheria. The study shows that if a child hasn't received the immunization for more than 5 years, it is a risk factor. Unvaccinated children are at a much higher risk than vaccinated children. Evidence suggests that a large portion of these diseases among adults have been transmitted from ill children and children that play an important role in amplifying the overall epidemic, even in countries where most of the cases were reported in adults. Diphtheria in men and women. Women had a much higher incidence of diphtheria than men, despite no evidence of lower serologic immunity. In a case-control study in Russia, the risk among women was not significantly elevated after adjusting for age, vaccination history, and household size or consumption. But having a 2-year-old child or older in the household was associated with a significant increase in the risk. School and family clusters have a direct correlation in multiple cases, while clusters of multiple cases and carriers in the workplace were relatively uncommon. Diphtheria taxoid vaccine. Prior to the completion of this study, low effectiveness of diphtheria taxoid-containing vaccine was suspected to be a major contributing factor to the diphtheria epidemic that began in 1990. The vaccine effectiveness for 3 or more doses was 97%. To control and prevent diphtheria epidemics, it is necessary to achieve and maintain high vaccination coverage with 3 or more doses of diphtheria taxoid among both children and adults. Epidemiology of epidemic diphtheria. In response to the 1990s diphtheria epidemic, health authorities attempted to maximize vaccination for children and conducted an unprecedented campaign to vaccine adults. The annual incidence decreased from 25.2 cases per 100,000 population in 1994 to 9.4 cases per 100,000 population in 1996. The decrease occurred as adult coverage increased from an estimated 25 to 30%. In conclusion, the mass adults vaccination was effective in controlling the Russian epidemic. In conclusion, there are only a few cases of diphtheria reported each year in Russia. A death hasn't occurred from diphtheria in Russia since 2005. Today, approximately 90% of all Russians have been vaccinated with the DTP vaccination. Remember, vaccination, immunization, and sanitation are all important factors in preventing another diphtheria outbreak.